The county said the clinic has been cooperating and attempting to fix the problem.
Bacteria in the water at a dental clinic sent 30 kids to the hospital in Southern California 2 years ago.
And also accused of using unsanitary equipment.
And in 2013, 2 oral surgery clinics in Tulsa, Oklahoma closed down, and thousands of patients had to be tested for HIV and hepatitis, due in part to instruments not being properly sanitized. Both horrific examples of what can happen when a dental practice does not properly clean its equipment and maintain the purity of its water. Last week, CBS 6 told you about concerns raised by a local pediatric dentist about a Richmond clinic that she and other colleagues claimed was not correctly sterilizing the handpieces used to remove cavities and polish fillings. Instead of using the acceptable steam heat method, she says staff members at the Forest Hill office of Dr. Richard Bird and Associates had just been wiping those instruments off with an intermediate level disinfectant between patients. The dentist says she also learned the lines that supply the water used to clean patients' teeth allegedly were not being treated to CDC guidelines.
And if you're not properly taking care of the water that's being used, what could develop in the water?
Well, it creates a biofilm, and it's heterotrophic bacteria that can live and multiply in those lines. Things like E. coli, endotoxins, which are a very serious concern. MRSA has been found inside of these lines.
An attorney representing the practice tells CBS 6 that Dr. Bird and his staff fully cooperated with a state review of the matter and says that the complaint was closed without any action being taken. But in the wake of the accusations, the CBS 6 problem solvers wanted to know what you can do to protect yourself and your children at the dentist. So we visited Dr. Sobia Carter at RVA Children's Dentistry. She says patients should not panic, but they should be aware.
To be honest, most dentists are doing the best they can. They care very deeply about their patients, and they want to do what's right for their patients. Most dentists are happy to answer any questions you have about sterilization.
If you're concerned, Carter recommends asking your dentist to show you how they sterilize their equipment. She took us through the process, which starts with removing any debris from the dirty instruments, then treating them with a chemical fluid, drying them off, wrapping them in packaging, and placing them in an autoclave.
And an autoclave is a machine that uses highly pressurized steam that remains at a certain temperature long enough to kill all bacteria and pathogens that are on those instruments.
Dr. Carter also suggests asking to take a look at your office's sterilization protocol.
You can ask to see the notebook that gives you sterilization protocol and training.
As for the water lines,
Then what about with the water? You know, how can you, as a patient, confirm that they're treating the water properly?
There's not a lot on the patient end that you can do. If you really have a question or an issue, ask to know.
she showed us her filtration system, something patients could request to look at as well. And she provided one last piece of advice to people worried about the condition of the equipment used by their dentist.
What should you do if you feel like your child or yourself has been exposed to something that was not sterile?
If you feel like you have been exposed to something that's not sterile, it's best that you go see your pediatrician for your child or your doctor for yourself, and they can recommend the appropriate testing.
Now, Dr. Carter also suggested checking to make sure your dentist or dental assistant always uses fresh gloves anytime they do work in you or your child's mouth. For example, they should not go touch a computer and then put the gloves in a mouth. And she says you should check to see if the dental instruments come out of a clean, sterile pouch or wrap. Working for you, I'm Melissa Hippolyte for CBS 6. Okay. Okay, 3, 2, 1. Now, Dr. Carter also suggested checking to make sure your dentist or dental assistant always uses fresh gloves anytime they do work in you or your child's mouth. For example, they should not go touch a computer and then put the gloves in a mouth. And she says you should check to see if the dental instruments that they're using come out of a clean, sterile pouch or wrap. Working for you, I'm Melissa Hippolyte for CBS 6.